My name is Bridget Vinson. I'm with Econometrica, and we are happy to be working with CMS to host this training for inpatient rehabilitation facilities around the quality reporting program today. We have a number of people here in the room, I think about 170, and then we also have another several hundred people online who are participating. So we're going to try and keep both audiences in mind as we progress with the training today. Oops. Okay, so first of all, I'm going to just go over a few logistics, and then we'll cover the agenda and the speakers. We're going to have you learn how to use Slido so that you can engage with the presenters over the course of the two-day training. And first, I'll take care of a few logistics. So if you're here in the room and you need to use the restroom, right outside the exit, if you turn immediately to your right and go all the way to the end, there are some restrooms located on this floor and immediately beneath on the bottom two floors. So there's plenty of facilities available. If you see anybody in a yellow shirt running around, we are here to help you. So if you need directions, guidance, please flag anyone who's anyone who's on our team that's wearing a yellow shirt, but we picked yellow because it's not a real popular color for most people to wear all the time. And then I guess next item is we'll talk a little bit about, I did want to mention one other thing. If you are interested in accessing the internet, you can connect to Sheridan Meeting, and the password is all caps QRP 2019. So in terms of today's agenda, we'll have a number of speakers. We're going to go over the changes to the IRF-PAI version 3.0 and the IRF-PAI guidance manual. We'll also be covering Section N, medications and drug regimen review, Section M, skin conditions, pressure ulcer injury, the IRF quality program reports, and that'll be a fun presentation. We actually have a case study for you to work on using sample reports, and the purpose is really to show you how you can use those reports to drive quality improvement in your facilities. And then we'll do a Q&A wrap-up, and then afterwards there'll be an optional session that'll be hosted by MITRE, and that's really an opportunity for you as IRF providers to share your thoughts with CMS about the Inpatient Rehabilitation Facility Quality Reporting Program, and that will be primarily an opportunity for you to speak. In terms of materials, there are a couple things. Online, all of the materials were posted last week. Hopefully you've had a chance to download the presentations or print them out if that's your preference. All of the materials for today's presentations can be found on the IRF QRP training website in the download section, so you scroll all the way to the bottom, and you'll see there are a number of parts. We have to fit everything into 20 megabytes or less. So there are 5 total zip files. There's a day 1, parts 1 and 2, and then there's a day 2, parts 1, 2, and 3. So all of the materials for today's presentations are located in the day 1, part 1, and day 1, part 2 folder. And within each folder, there's a subfolder for each course. And then within that folder, you'll find not only the presentations without answers, and we will be posting later the presentations with answers, but for example, for the reports presentation, all the materials that are needed to participate are available online, and that's most important to the participants who are participating online. For those of you in the room, we didn't print out all of the presentations, but everything that you need to participate in today and tomorrow's activities are printed out for you and in your participant folders. So in your participant folders, there's a handy reference document, and you'll find in your left-hand pocket the agenda for today and tomorrow, the complete biographies of all of the presenters. You'll find a convenient acronym list, and we do have the acronyms at the beginning of every presentation, but that acronym list includes all of the acronyms used throughout the entire 2-day training. Then there's also a document called the Action Plan, and that document has a page, and on each page we encourage you to write down ideas. So as you're listening to the presenters today and you're thinking about how do I operationalize these changes, we encourage you to write your ideas down. And there's an example there. This isn't a recommendation from CMS. This is just some of our presenters thinking, gosh, if I were taking this back to my facility, here's some considerations that I might take into account. Are there processes that need to be changed? Are there policies that need to be changed? Do I need to talk to my IT department to make sure that data elements are collected and reported? Do I need to do training, and who do I need to train? So that's an opportunity for you as you're listening to kind of think about, well, what do I need to do to make this real at my facilities? Then there are also 2 handouts in the left-hand pocket, one called Practice Coding Scenarios for Day 1 and one for Day 2. And those basically are the same scenarios that will be used in the presentations, but we'll present the scenario in the presentation, and then essentially we'll click so that you can see the question and the responses. If you'd like to keep that scenario in front of you to reference, because some of them are a little long, that's just a handy document for you to use during the presentations themselves. For those who are participating online, most of what I just mentioned, with the exception of the last practice coding scenario for Day 2, can be found under the May 2019 IRF-QRP Provider Training Day 1 Part 1 in the first subfolder called 01, Welcome Introductions Day 1. The practice coding scenarios for Day 2 are in the welcome presentation for Day 2, which would be in Day 2 Part 1. So then in the right-hand folder pocket, you will see that there are a number of items that are related to the IRF-QRP reports presentation that will happen later on today. These are the sample reports, the worksheet, and a reference document related to the IRF-PAI report section J that you'll be using during that case study. And for those who are online, it's located under the Day 1 Part 2 folder in the subfolder for the reports training. Then the other items in the right-hand side are related to items that will be discussed tomorrow, and I can go over those then. So hopefully that sort of orientates you to the materials in today's agenda. I'm going to quickly give a quick introduction for each of our presenters. So we do that at the beginning of the day, and I'll speak to the presenters that are here today. If you want to reference their full biographies, those are in your participant packets or online in your welcome folder. For the participant packet is actually handout number 2, and you'll see there's a little number on most of your handouts that reference that initial document on the left-hand side of the folder. So our first presenter today is going to be Katie Brooks. Katie currently works as a nurse for CMS and serves as the IRF Quality Reporting Program Coordinator. She received her BSN from the University of Nebraska Medical Center School of Nursing, and while practicing as a nurse in acute care and neuroscience as critical care, she maintained a focus on quality improvement in both patient and electronic health records. She went on to receive a Master's of Science in Nursing Informatics from the University of Maryland School of Nursing and worked as a nurse educator and informaticist for the EPIC project at the Johns Hopkins Health System prior to transitioning to CMS. Our second presenter today on Section N is Terry Kahlert-Eng, and Dr. Eng is the Senior Manager and Public as a senior manager in Public Health and Quality Measurement and Policy Program in RTI's Division of Health Services and Social Policy Research. Since joining RTI, Dr. Eng has worked on several Centers for Medicare and Medicaid Services projects. She currently serves as the long-term care hospital lead for the development and maintenance of symptom management measures project funded by CMS. This project is focused on the development, maintenance, and reevaluation of quality measures for post-acute care settings to develop and implement quality measures for the LTAC quality reporting program. In addition, she is also the RTI lead for the drug regimen review conducted with follow-up for identified issues quality measure. Our third presenter today, speaking on section M, will be Ann Spinard. Ann is a principal and vice president at Qualidine, chiefly responsible for program operations and overseeing major initiatives at Quality, including the Quality Innovation Network Quality Improvement Organization contract with CMS. Throughout her extensive career as a long-term care and geriatric specialist, Ann has led national quality patient safety and data validation projects. She has also taught nationally to provider groups such as this and CMS, and she received her Bachelor of Science in Nursing from Western Connecticut University, a Master of Science in Nursing, and a Doctorate of Nursing Practice from Sacred Heart University. She also serves on the Connecticut League of Nursing Board and the Avita Institute of Gerontology Board. And our final presenter today will be Deb Weiland. Deb is a registered nurse by training and a nursing consultant on the Division of Chronic and Post-Acute Care team at CMS. Prior to joining CMS, Deb worked as a federal contractor, serving as the lead program manager on the Quality Improvement and Evaluation System contract, supporting 5 post-acute care assessment submission and processing systems and downstream reporting of the data, including the quality reporting program quality measures reports. Deb maintains her resident assessment coordinator certification through the American Association of Nurse Assessment Coordinators. And just a little bit of general information. As I mentioned before, the presentations that are currently loaded on the CMS website do not contain the answers to the slides, nor do they give you the rationale for the case study. We need to engage with you as participants, and that's our way of making sure that what we're training or the material that we're presenting, that you're absorbing it. So we use that data actually to help inform whether or not we're doing a good job training you. So we don't want to give you the answers ahead of time. We will, however, post the presentations with the answers after the training. And so those are available for you to download and use as you see fit with your staff to adapt them as makes sense for your facilities. In addition, there will be video recordings of today's presentations ultimately posted to the CMS YouTube site. And there, of course, will be a Q&A document with the questions and then that you'll all be bringing to us and responses to many of those questions posted after the training. When those materials are posted, we'll send you an email. Anyone who registered for this training will get an email letting them know that the materials are available. Finally, everybody here in the room who signed in and participates over the course of the 2 days will get a certificate of completion. And we previously have not offered certificates of completion to those who participate online. But all of a sudden, since we're using Slido, we thought, wait, we really could make sure that they're participating if they're actively engaging with the content. So if anybody is viewing online and would like a certificate of completion, there are basically 3 criteria. The criteria are, 1, that you create a profile in Slido, and I'm going to go over that in a few moments. And creating that profile is important for 2 reasons. 1, for anyone who wants a certificate that isn't participating in person, it allows us to track your responses to the polling questions. And what we're going to look for is if you put in a profile in Slido, and we can see that you've responded to 80% of the polling questions over the 2-day time period, and you indicate in the training evaluation at the end of the training that you'd like a certificate of completion, then we will be happy to send that to you, as well as providing certificates of completion to those in the room. And I know some of you may want those certificates of completion because while we don't offer continuing education units, I have heard of a number of participants taking the agenda, the certificate of completion. Sometimes your professional associations may ask for the speaker bios, and then providing that information to your professional organizations, who then may grant you, I cannot guarantee, but may grant you continuing education units for attending today's and tomorrow's training. So with that said, this is the time when we are going to ask you, we ask that you bring a fully charged laptop and or phone to the training. Participants who are joining online can use their desktops for this as well. So if you all wouldn't mind getting out your phones, and these first few icebreaker questions do not count toward the 80% needed to complete the certificate online. But the first thing that we're going to do is try using answering a few polling questions just for practice. So the first thing I'm going to ask you to do is go to a browser on your phone or on your laptop or desktop and type in www.slido.com. And then when you get to that first slide or first screen, it'll ask you to enter a code. And the code is econometrica, capital or lowercase e, it's not case sensitive, ECONOMETRICA. And when you get to the next screen, you should see something that looks like this. And I'm going to use a show of hands. So how many people in the room have accomplished that task? How many people need a little more time? Okay. I'm going to give it a couple more seconds then. It's econometrica, so it's ECONOMETRICA. We gave a tricky code just to make sure you're awake this morning. Okay, so hopefully everybody's with me also online, and we're going to actually try a poll. So across the top, you'll see questions, ideas, and polls. By default, you're sort of already in the polls area. If you're not there, touch polls or click on polls. So I'm going to ask you a series of questions, and you're going to respond, and we'll see how we do. So since its founding in 1889, Kansas City has been known as which of the following? The gateway to the Southwest, City of Fountains, Paris of the Plains, Heart of America, or all of the above? And when you select your answer, don't forget to hit send or submit. But it looks like everybody's getting it. So far I'm seeing about 131 responses, 143. Numbers are continuing to climb, and it looks like we have some hard choices to make here. No obvious winner, except for maybe E, all of the above, possibly, but let's see. Let's check the correct answer. The correct answer is all of the above. All right, so easy, right? We're going to try a couple others. So Kansas City claims to have more fountains than any other city in the world except A, Paris, B, Rome, C, Venice, or D, Madrid. And I have to say, we did this question with the skilled nursing facilities on Monday, and this was a tougher question than I thought it might be. Okay, but I don't want to make you doubt your answers. All right. So it looks like we've got about 300 and almost 50 people participating. All right, so let's check the correct answer. The correct answer is Rome. All right, we have another couple questions. This one's really tough. Okay, Kansas City has more blank restaurants per capita than any other U.S. city. A, barbecue, B, seafood, C, Mexican, or D, French. Okay. Well, there's a couple there that are thinking Mexican. Well, French is climbing. Okay. All right. And seafood, I did hear there's some good sushi here, so. All right, so let's check the correct answer. The correct answer is barbecue. And I can vouch for that, having gone to a barbecue place earlier this week. Okay, next question. When Walt Disney opened his animation studio in Kansas City, which Disney character was inspired by a real-life animal living in the building? A, Donald Duck, B, Jose the Parrot, C, Mickey Mouse, or D, Goofy the Dog? Okay, another tough question. All right. Just give a couple seconds for the folks online to get a chance to answer. All right, let's check the correct answer. And the correct answer is Mickey Mouse. All right, we have one other type of question. Oh, well, this is a question that I'm just going to check. I think you can type the answer in. No? Oh, wait, sorry, this is a multiple choice. I know A, the person on my left, B, the person on my right, C, people on both sides of me, D, I haven't met my neighbors yet. This is a great opportunity to network, by the way, just a plug for that. And E, I'm participating online. So right now, looks like most people are participating online at 192 so far. And then some people know people on both sides of me. So again, just a plug, this is a great opportunity to network. So if at some point you want to change seats and meet someone new, it's a great opportunity. Okay, there is obviously no correct answer to that, but let's move on. And we have one other question, and this is a type in your own response. So let's see where we're all coming from. So if you could type in the response in terms of where your home state is. Where are you coming from today? So we've got Georgia. Oh, we've got yay, Oregon. That's where I'm originally from. Michigan, Puerto Rico. Wow, that's a long ways from home. So looks like we've got people participating either online or in the room from pretty much all over. So thank you again for joining us today. All right. Now we're going to move on to the next section of the training, which is the whole idea about setting up your profiles, because the profiles are important for two reasons. A, for the people who want to get a certificate of completion that are participating online, but B, even for the people in the room, it's important for us to know who you are, because when you use Slido to submit questions, we sometimes need clarification as to what your question actually means. And you're going to be asked to put in your name, your organization, and most importantly, your email address. So you see that little avatar up in the upper right-hand corner. It looks like a head and shoulders. If you click on that, you're going to be asked to enter your name, and it would be helpful if you used your first and last name, your organization, and your email address. And when you are done, I think there's a button that says send or submit at the bottom. Really important that you click that button, otherwise your profile really won't be set up. And you will realize success when you complete that and that little avatar turns to your initial. So mine would turn to B for Bridget. So are we pretty well set up in the room? Who needs more time? Okay. Give folks just a couple more minutes. So remember I indicated that there are 3 tabs across the top: polls, ideas, and questions. We're going to be using polls and questions. So when you want to submit a question, you want to touch the field or click on questions, and then you'll have the opportunity to enter a question. When you're entering questions, you're also going to have the opportunity to vote for a question. So we're going to focus on answering the questions that get the most votes, because we know that those are the most important questions to the majority of the people in the room. Some of the other questions, if they're not voted on, I believe that they'll be going to the IRF help desk, and then you'll be getting a response from them, because maybe that's more specific to your facility. So when you're about to enter a question, think it through and look at the list and say, is my question really similar to some other question? And if it is, like that question so that it rises to the top versus typing in a duplicate question. It just helps us to know what's really important to you. Okay. So yesterday, or on Monday, we had a sniff training here, or Tuesday, and I asked people to enter questions, and we got hundreds of questions coming in. I said, make up a question, but we're not going to do that, because then that sort of skews our results, and my tech team gets really mad at me. But you can type in questions. If somebody's already typed in a question just for fun, and you want to practice liking a question, you see the little thumbs up. All you have to do is click on it, and that means that you voted for that question to rise to the top. Any questions about submitting questions? Okay. And then I have 2 items left. One is, again, we already sort of talked about the action plan ideas. This is what the sample looks like. Again, it's just some ideas that our presenters had, not specific recommendations for your facilities. And lastly, I did want to let everybody know that we do have 2 guests who are joining us here for the Center for Medicare, Susan Seagrave and Katie Kramer. They're sitting in the back table, maybe if they want to raise their hands, at the presenters table. They are available to you. We're not doing any specific presentation on payment-related questions, but they are available to you to answer some questions that you might have regarding payment-related questions. So with that, I think I am very close to being done here. And if Katie Kramer wouldn't mind coming up to the front, I believe she's our next presenter.